way. Like what when you see a case, what strikes you first? What strikes you in the face? This is your approach. So in this case, what was so striking in my face? So it was the yellow pus, and it was the latest stage of inflammation. This was so striking. This hit my face first. So I just took it. So I'm going to show you another. Yes, I'm going to show you another acute case. This was a very recent case of mine. Uh, this man, the case was ulceration post cellulitis. So this man is an old patient of mine. He got admitted at the hospital for cellulitis for 14 days. The family told me this, but he got already attended in the admitted in the hospital. But there was, but even after getting a lot of antibiotics and painkillers, there was intense pain. Not getting better with taking antibiotics and other medicines. So these were the remedies. These were the allopathic medicines which are prescribed for him. I don't know about all these drugs, but I've just wrote it down. Rabeprazole, B complex, linezolic acid, linezolic tab, Maxelf paste, trypsin chymotrypsin tab. These were the medicines which was prescribed for him when he discharged and came home. So he was an old patient of me. So his wife called me, doctor, you should come and see him at home, because he was a kind of a very social person. I used to see him every time on the street, on every evening, but suddenly he disappeared from the outside world. So I was worried, and I was, when I heard this, he wasn't, he was completely bedridden, and he couldn't move from the bed. So I thought of meeting him in person. I went to his home. So when I went to his home, what I was seeing is this huge big man was in intense pain, and it was burning pain. When I asked, intense burning pain. And I cannot I cannot tell you enough that how much pain. We also see the pain when when you see him. So I'll show you the picture so that you will understand how terrible the situation was. So when I first saw him, this was a picture his wife sent me. Doctor, somehow you come and meet him. This was a picture while she opened the gauze and to dress the wound. Now, are you able to see that? And this was the video I took when I went to meet him. This was a video I took. See how terrible it was, and imagine the pain he has gone through. Imagine the pain. How many of you got leg pain watching, just by watching this? So this was the condition, and if there is a scale to rate the pain, it would be 100, and that was the situation. So what do we do in such cases? And when I asked him about the symptoms, he said, doctor, intense burning pain. He is sleepless at night due to pain. His wife said so many symptoms. He's irritable due to pain. His wife said he tells he's going to die with the pain. It's like a pain of death. This is what his wife said. It's like a pain of death. And he very often changes his position to obtain some relief somehow. And no position would him relief in for the condition. So, and he said he was very, very weak with the pain, very restless, extremely restless. When I saw him, He was lying at the bed and he used to put his feet on the wall. See, somehow he used to change position and he was very restless and he couldn't really tolerate the pain, intensity of the pain, and it was burning in nature. So when I saw, it was a big ulcer with discharge on the back of his leg. So what do we do? How do we analyze this case? If I ask him more about his mental symptoms and fears and dreams and delusions and everything, tell me about your nature, he's going to slap him. I'm sure. So in such cases with limited information, what do we do? You tell me, what do we do? Limited info. Look at what is characteristic. Look at what is something which punches on your face first. What is something which punches on our face first when you see that case and when you listen the narration? For me, it was the pain, right? And it was the pathology and his entire state of mind that was so peculiar, right? So I again open Fatak repertory and I'm going to take few rubrics. First thing, tell me the pathology. Where is the organ of affinity? Somebody tell. I'm, I'm expecting someone to, tell the area of affinity. Tell me. Dear doctors, tell me, what is the area of affinity? Are you going to say skin? Yes. Extremities? Mm-mm. But I'm going to tell you, what was the condition? What was the condition? It was cellulitis. So if you look at Fatak repertory, there's a rubric called cellular tissue. Cellular tissue. And there is a cross reference that is cellulitis. It's the inflammation of cellular tissue, right? So I took the general rubric cellular tissue and what could be the possible second rubric? See, it's not about the rubric. What could be the possible three or four very prominent symptom in that case? See, it was the nature of pain, right? It was what is the type of pain? It was burning. See, it was burning fiery. That was a rubric given in Fatak. Burning fiery. And what was the nature of the patient? What is the nature of the patient? What did his wife said? His wife said, Doctor, he's telling he's going to die with pain. Pain of death, he says. It's like the pain of death. He's going to die with pain. This was the nature. So we have a rubric in Fatak repertory that's called death. Death agony. See, what you mean by agony? Agony is the extreme mental and physical pain. So when you see this case, it was not just physical pain, it was extreme mental and physical pain, right? So that's we call agony. So I took this rubric, death agony. So what remedy could have, come? What is the expected remedy? Somebody already said ours, and there is another remedy which covers almost all the symptom is tarantula cubensis, and there is Apis and Vespa. All these, what are these remedies? Insect remedies which has a lot of burning pain. Vespa is wasp and Apis is honeybee, you know it. So a lot of burning pain. This was the symptoms, and I've got a clue to the remedy. What could be the remedy? Then what should I do? Then there's only one thing you can do. You should read it from the Materia Medica. So when I open Tarantula cubensis and read it from Materia Medica, it's written, it's a toxemic medicine. It's given for septic conditions. Look at the pathology, look at the nature of action of the remedy, look at the genius of the remedy. And it is adapted to the most severe type of inflammation and pain. And there is prostration. various forms of malignant suppuration. And what is written here? Pain of death soothes, soothes the last struggles. It's a remedy for pain of death, pain of cancer. It's a pain for violent, malignant, septic inflammation. And it's a remedy for that. And it's written that it's it is as a curative and preventive remedy, especially during the period of invasion. What is invasion? You know, especially during the period of spread. So if you look at skin, look at the symptoms. There is a lot of symptoms related to carbuncle, burning, stinging pain, gangrene, abscess, where pain and inflammation predominates. So this is how you should understand a remedy. What is the most predominant symptom? What is the genius of a remedy? So in tarantula cubensis, it's always the pain and inflammation which is predominant, and there will be burning, stinging, pain of agony. So I gave him I gave him tarantula cubensis.